Welcome to the Nobody Tells You This podcast, where we will be debunking popular health myths, fads, so that you can get fact from fiction and make informed health choices. Join us every month for new episodes. We are probably going to be one of the most honest spaces that you're going to encounter online, and you can see that we are very transparent and we are sharing with you. This is not bells and whistles. We are new to this. We are driven by our passion to give you information, education, and advice. And we're going to figure that out whichever way we can. Welcome, Veerpal. Would you like to introduce yourself?
Hi, everyone. Sorry about the tech issues. We're just navigating our way how we can synchronize everything, but I think we're getting there. We got still a lot of others. This is our first episode after our initial introduction. Rav have given her introduction. So my name is Veerpal, everyone knows. I'm the Menopause Clinician, clinical pharmacist, more than 16 years of experience as a pharmacist, work for the community in primary care for different health cares. But my main expertise are mental health and menopause, and I'm proud owner of Skin and Aesthetic Clinic as well. Today we're going to talk about the questions we get asked in my community workshop by the clients, same to Rav as well, and nobody tells you the actual those questions. They're health related, well-being related, or it could be anything we will be discussing in our weekly sessions. And today we have picked a very popular topic, and I think I had around 20 messages, and same Rav had, and from there our conversation started. So we're going to start that topic. And I think Rav will take the lead on the session now.
So I didn't introduce myself, but that's because this is the way things go around here. I was saying we're honest, we're transparent, we keep it real with you. We are mums managing our homes, juggling everything. And, you know, we are making a commitment to be here with you every week, 3 times a month. We want to be here with you. And we will do that amongst our busy lives. And so, you know, please be part of this journey with us and show us patience as we go. But I'm Ravneet. I'm founder of Neet Nutrition, health and wellbeing coach for the NHS and privately. My mission is to help women and all individuals find joy in their relationship with food. And that means by helping us ditch diets and release the oppression of those diets and find food freedom. And a lot of people approach me because the name of Neet Nutrition for weight loss. It's a very common thing. And I joined the NHS in January 2023. And I'm sure that the injection was coming out around then or was being rolled out and used with certain patients around then. So I've been seeing consistent requests, especially around October, November, I want to get this weight loss injection. I want to get this weight loss injection. And we might even cover the tablet, an Orlistat tablet. We'll see how we go. Now, I was a bit dumbfounded. I was like, oh no, thanks for coming to the weight and health and wellbeing session. I am not clinical. I do not prescribe, and I have no idea what you're talking about. So I tried to get my head around it, but we've seen this situation boom because it's a really big hype at the moment, the weight loss injection, and you may know it as Ozempic. So what is medical weight loss, Veerpal? What is it? Tell us.
Okay, so Ozempic, first of all, because we need to understand as a community, sometimes a brand will take a lead and the actual drug will mask behind that brand, and everyone will just name that drug as a brand and wouldn't know what actually is the drug behind that brand. So Ozempic is one of the weight loss drugs. It's a brand, very popular brand, and it was the first brand which came, but after that, other pharmaceutical companies made. So Ozempic is one of the drugs, it's one of the inhibitors we purely was added for diabetic patients, diabetic only type 2, where their blood glucose HbA1c is not controlled with diet, lifestyle, or any other, the basic diabetic medication, the metformin, glyphosate, or any type of other insulin. So, and where patients have got obesity as well. And this drug really, really worked well for these patients. And I'm not going to lie, kind of life-saving as well, very drastic decrease in the HbA1c, improve their quality of life as well.
Yeah.
And Ozempic is one of the brands. So in that we have got tablets and the injections. We got a couple of brands. And then similar to same drug, it works. We have got couple of other drugs which works with the same sort of mechanism on the same inhibitors. And what it does, it increases the hormone which really produce the insulin in our body. That's what it does. And it also
what is this hormone? What is this hormone, V?
It's called incretin.
Got it.
Yeah. It's an incretin hormone which releases the sort of insulin in our body and which controls the blood glucose. And it also suppress the blood glucose in our liver as well.
I'm a total geek for this stuff. I need to know the names. I am that person that's going to go and Google things.
No, don't ask me live. But yeah, so this is a very simple mechanism. The weight loss injections is 2 to 3 types of main drugs. It comes mostly injected from Ozempic is one of the brand. I'm not picking on any brand here. It's just the drug we're going to highlight, how it works on the body, what it does, what's the good and bad about it, should you be taking or not about it. That's the whole highlighting, and you can make a very informative decision about yourself, which patient can benefit from it and which can't. And it's not to say
patient, individual.
Yeah, every individual is different, their genes are different, their lifestyle is different, and mechanisms will work in a different on each individual. And that's what we're going to highlight.
And I'd love to know for people to leave comments, people watching on replay, you know, which brand have you heard of? Did you know there was weight loss injections, tablets? Do you know the mechanisms? Like, what is your understanding of it? And so as I then started asking my GPs in my practice and the pharmacist, I was like, what is this? And they were like, this is a medical use drug for, like Veerpal said, type 2. And I was curious today, I was going to ask you about type 1, but you've kind of answered the question. And it can be life-saving, life-improving. And this conversation came back up again recently because these injections are out of stock. And I have patients. I have a client, a private client, don't I? And I was saying, V, is this going to be of benefit to her? You know, we've asked her to push the pharmacist, keep checking with her doctor, and they're still out of stock. This is a 69-year-old woman who could genuinely benefit from what Veerpal has described. And that's the other question that I'm going to ask, and we will answer for you. Is it working for the people that we know are taking it? Not your TikTok followers, okay? Please be mindful of when you're watching unregulated content online. We don't know what their motives are and what the basis is. And when a young woman looking great, wearing designer clothes, or I'm being very generalist, is telling you it's great and it's changed her life, I still want you to be really cautious. That's one individual, and we've just touched on it, and it's dependent on the individual. So that's the point of today. Veerpal knows the data of a larger cohort of people. Okay, so we now know what it is. We know what it does, which is inhibit your appetite. Is that what you said? And it helps produce.
Yes, that's unfortunately a clinical thing, just to release. That's the pure use it was made to control the diabetes. So now, why we call it weight loss injection? Very, very simple. It clearly say on their website, so pharmaceutically on the guidelines, it may lose the weight. So how it works is basically it mimics the brain. It gives a message to your brain, you're not hungry. So basically, close your mouth, don't eat. So it works in two ways. You won't feel hungry. That's why it said it suppress your hunger. You're not going to feel hungry, and it doesn't give the signal to your brain, oh, I'm hungry, give me food. And secondly, what it does, when psychologically sometimes our tummy is not hungry, but our eyes are hungry. But what it does, the food you have eaten, it really slows the metabolism. The movement of the food is very, very slow. So you think your stomach is so full, you don't even go to the food. So it kind of that feeling psychologically gives you, you don't go near the food. And the criteria for this is the patient whose diabetes is not controlled, the BMI is for obese patients, so a BMI over 35, and that's when assessment can be done. That's the question. So if a woman comes, diabetes not controlled, and BMI over 35, we know it's a psychological issue. Some people cannot control. They love food and it's fine. And they've gone into so much of the deep and where it's hard for them to break those habits of lifestyle, to avoid the food, the cakes, whatever they eat, and they don't know what to eat. Really
the habits in food are really, and
Yeah.
I found this, that people try their hardest. I'll touch on that in a bit as well. They try their best, but actually their blood sugar's out of control. The medication that they've previously been taking is not helping it, and they're looking for something. Then they need some drastic action. Yeah.
And that's clinically they pass the criteria, but then they need a clinical assessment. The clinical assessment is because it has its own side effects. Very, very sort of, I can say, you really need to look into the side effects. It does affect your kidney, it affects your vision as well, it affects your liver as well. That's the main
to my other question.
So if you really going to, so when a clinician make a decision, they really have to look for the patient's profile and a close monitoring of it. And that's when it comes, should you be having under a very close monitoring of a clinician or someone just inject you who's not monitoring you for something else? Yes, you may be looking to lose the weight, but what other damage long-term you are having? Yeah, there is very short-term side effects, nausea, vomiting due to the hypoglycemia, that's fine, fainting. But the long-term business is the kidney, the liver, and we have seen increase in pancreatic infections as well, if you drink pancreatic tightness as well. So I need to look at the picture.
I have to tell you, somebody reached out to me, someone I really, really respect, and I value their opinion, and she said, oh my God, I'm so glad you're doing this live. I actually did sit there thinking, should I think about this injection for that stubborn bit of weight that I've just been trying to lose and I'm not getting very far? I've seen and I've heard from my friends how well it's working for them. Could I put up with nausea, vomiting? Could I just put up a bit of digestive distress for this result? And there was a study done, I think it was Women's Health. I will put up the link for anyone interested. It's in my notes. People were asked, would you sacrifice years of your life to have a smaller body? And the vast majority of women, I think it's over 70% of women said yes. Like they will give up being 78, being 90 to have a smaller body now. And so when this idea of there are side effects comes up, but you can buy it privately, people are deciding, well, I'll put up with it. So actually it's really important what you said, Veerpal, because in my generic and my basic non-clinical awareness, when I'm like, I didn't see there were the other longer term and wider side effects.
Yes, so that's the longer term. And also, when you go, if you just go on Ozempic pharmaceutical website, the benefits are hidden under the side effects. That's very, very important. There is a reason. Yeah. And I'm not saying it's not safer to take. It can be given, but the patient has to pass the criteria and a very, very close monitoring. Kind of is a life-saving for a long term for a patient who's very obese, diabetes is not controlled, and have a cardiac risk. That's a blessing for them. We work very closely, and you asked me the question, does it work? Yes, it works. Because patient is not eating, their lifestyle is controlled, and then they start to get a motivation, they start to work more around that, they lose weight. But then the next question comes, when you stop it, you have the sort of chances you will gain more weight.
Oh.
Because the way you lose the muscle, then you will start to gain more fat after if you have not adapted a sustainable approach. But then your body and brain start to give you a wrong message.
Pause here. Yeah, we've got to pause here. I am the real life Ozempic. Okay. I help women on a daily basis understand true hunger and true fullness cues. And then they make informed decisions how they're going to treat that hunger. And sometimes it's with food. They start with me, and initially it was often food. Then they change their approach and they start using other mental health self-care techniques. And me and Veerpal talk about these. And that's what I teach them, the mental health toolkit, so that food isn't everything that they rely on, because it is a very, very important tool. Food and comfort eating is an important tool. So when I'm saying I'm saying I'm a real life Ozempic, but essentially what I'm saying is this is why people are monitored, because if you're not taught to look out for your own bodily cues and functions and signs. There are medical reasons why some people cannot. I don't want to put everyone in the same basket, like you can all learn. There's a lot of reasons why people have that difficult relationship with their food. But if that relationship is still there, and this is what I wanted to ask you, you're taking the injection, you're eating less, but you're still eating, for example, highly saturated food. You're eating long shelf life food with high sugars, etc. You may get away with it, right, during the period of having the injection?
Yeah, you will. Yeah, you will get away with it. That's true. But then you could, because in my menopause clinic, and I get the woman, they are so much, as you said, the psychological depression and the confidence loss, and then obviously the willpower has gone. And because in my skin and aesthetics, I can easily offer this injection, but I don't, because that's something, as a clinician, I know I may not be able to provide them sort of close monitoring, and I need to, it's all about well-being of the long-term well-being of an individual. And they ask the questions, and I always say, you are not obese. Just work on the long-term sustainable approach, and this will cause them more benefit. And I don't want the woman to get hooked to something and then they have to really not really getting on it. And there is a solution to it. It's really getting into the routine of having a long-term sustainable approach, and that's really what we work on to lose the weight. The next important thing, which we have heard, I think that's where it triggers a lot of women to message me, apparently, is a safe as a cardiovascular safe.
Yeah.
So we always say
Ozempic injection, but there are other brands of injections which are now coming under the category. So we're looking at medical weight loss options, and right now we're talking about the injection. And Veerpal is about to cover something really important, because a lot of hype in the media about cardiovascular benefit. Tell me.
Yes, so cardiovascular risk. A person is at the cardiovascular risk, they're obese, their weight is over, they're already at a risk. If they're diabetic, their glucose levels are up the roof, they are under the risk. And then when they will have the injection, they will lose the weight, they're going away from the obesity, the BMI is low, their breathing is improved, their heart is more protected, and that's why it increased the risk. There is research where it says the mechanism still not clear. It say they did the trial, they say only Ozempic, semaglutide drug, which is in Ozempic. It has in some trials actually patients who were not diabetic, and regardless their weight lost or not, it improved their cardiac health. Only if they were in the risk of that cardiac, they had the cardiac issue already. So if, for example, a person just overweight, want to lose the fat, say, oh, my heart will be protected, I'm going to have Ozempic, you will invite more problems to your body than the benefits. So think about, do not only take about the weight loss, see what else you can do rather than just having weight loss injection, because it does come up with its own wonderful long-term side effects as well, which you may not notice for a couple of years, but it can if it's not closely monitored. So if someone have injection, they need to have regular kidney function checked, their regular heart checked, their pancreas, gut health as well checked, and their liver function as well. Very, very important.
Yeah, you made a really valuable point, and I think that I'm going to really emphasize this. Those individuals that have the uncontrolled HbA1c, which is their blood glucose, they often have other underlying conditions. And it's not just that they've come in with diabetes, given the injection. I've had some young ladies who have diabetes type 2 as a standalone condition, and they are pushing for the injection. But some of the intention here was for people that have other wider issues and more health diagnoses. So if there is a downside for them, there is a majority upside because of the quality of life impact through the weight loss. And I think that's, I'm not in the world of where people are doing things purely cosmetically, but I know on TikTok and out there and other places, it's just being sold as this like magic weight loss drug.
Yeah, it's no magic weight loss. Means I do aesthetic treatment, but it has to be approached for the benefit of the person who is gaining, and you give them the option. You give them the drawbacks first, the risk first, and then you give them the benefit. Actually, they need it. if a woman, if I do for it and I do prescribe in my NHS clinic, if a person is obese, taking the whole full health picture, and we think it will beneficial for them, and we do offer them, and that's the pure. But it has been misused, and that's why you just asked me why there is a shortage. Missold. And we had numerous cases. The product is not legal in UK. It's been sourced from God knows where, and people are injecting themselves privately, and it's causing them so much harm than benefit, obviously, as well.
Isn't even Ozempic. They're finding other versions.
It was on a BBC documentary as well. So it's not right. So because when the demand increase, then the faulty products that we call it black market comes in.
You know, I was just thinking about the fact that pharmacies are allowed to sell it privately. So then in the NHS, we have less because they're selling it. And that's their prerogative. I get it. And that's why we keep trying to put forward this ethical standpoint that please, if you don't have a medical underlying condition and you have got other options, how much is it for do we know how much it is for this injection online privately?
People are selling for £60. Yeah, they are injecting for £60.
Wait, the real one or the dodgy stuff?
Yeah.
The real one
So
or the dodgy stuff?
is that cheaper, whose market price is that cheaper, manufacturer is not even making for that, and someone is giving you that injection. That means that is not the right. That is not the right thing. So,
and therefore, if someone's buying an actual trademarked, official, legal injection in the UK, and they're going to Boots, because I know Boots Pharmacy do Manjaro, that's another name of a weight loss injection that I've heard of. I'm saying it, I don't even know if I'm pronouncing it right. And that's coming in at around 150, like 200. You could probably go out and get some coaching for that much as well. So like invest in yourself fully. But yeah, Boots Pharmacy are not going to monitor you. I don't know how their rollout is working. I totally forgot about the black market aspect. Like one day we have to come back and revisit things like the caffeine tablets and fat loss tablets that are sold on the black market that are so dangerous. We're probably not even going to get to touch on it. But so yeah, we're talking about Ozempic and medical weight loss injections. Veerpal, Sandhu, clinical pharmacist, has been giving us the insight on what the evidence is and who it was intended for. So you've seen people personally using this and it is effective. How much have you seen the more common side effects of nausea, digestive discomfort? Is that quite common for most people?
Yes. So because if the injection is given to a person without knowing their baseline glucose level, it's injected to a person, they're going to go in a hypo. And when they will go in a hypo, that's when they can get really, really unwell. So every person...
We need to say that again. We need to repeat that. If you do not have type 2 uncontrolled blood sugar, diabetes, HbA1c, so you could be someone with type 2, but it's controlled with metformin or some other drug. This is so important. You could be walking off the street, going into the pharmacy and putting yourself at risk of a hypo.
Yes, you will have a risk of hypo. So because every person have their own baseline glucose level. So some people have high, some people have low. And if someone their baseline glucose level is not known or not been checked and they've been given this injection, they will go hypo, and then people really get unwell, end up in A&E. And we have seen a lot of cases all the time, and it's been in the news as well. So if you make a decision... So your blood sugar drops really dangerously low, isn't it? And you can get... It's not just nausea. Like, this is actually genuinely your body has no resource to kind of energize. You can faint, and lots of things can happen in a hypo. Yeah. That's true. And if you really make a decision, you want to have this injection, and you think, make sure you're going to any private, whichever, going to a proper clinician. They done your whole blood test. They're monitoring you, and they're sourcing the product from a UK pharmacy. So UK pharmacy can only get the products from the listed suppliers. If your clinician the person who's giving you injection is not a registered clinician, they cannot get product without a prescription. It's a prescription-only medication. If your clinician person giving you injection, they are not registered medical professional, then it means they can't write a prescription. If they can't write a prescription, they can't order that product for you. If they can't order that product for you, it means they have resource from somewhere, not a registered premises, it's not a registered pharmacy, and that can be harmful to you. But don't put your health at risk at all.
And so that's the kind of cases I wouldn't know about in the health and well-being world, but you obviously have come across where you've seen people taking
all the time.
Non-registered products, not just for weight loss, probably across the board. Like I know people do sleeping tablets online and fat loss tablets online, caffeine, etc., etc. Steroids, in training for men, steroids were quite really popular. You've seen when people are taking unregistered medicines, like that damaging effect it can have on them.
Yeah, and research the price. If something is way cheaper for that product, it means it's not a genuine product, and the person who is injected is not genuine, because a clinician will not put their profession under a risk just for a few pounds profit.
Yeah.
So if they're charging for their knowledge, for their skills, their prescription charge, and a genuine product as well at the same time, and for the result, because they're monitoring you closely after.
Yeah, I've got to throw it in here because when I found out, Veerpal, that you did the injections, I really want to make this, people always assume that I'd be really against body modification because I'm into self-acceptance, body acceptance. But one thing I know is that some people do have slim frames and they have a little belly, or, they just have a certain mental health kind of stigma around a body part. I'm not against people using things like targeted fat loss. People do fat freezing, there's injections that can target certain areas. I think that people should have autonomy over their own body and their choices. I'm all for people making their choices, regardless what I think. Yeah, that's my own judgment. I think women and people should have a right to choose for themselves. However, I think that the most important aspect that we're trying to really bring home is know and do your research. Know the long-term side effects.
Yeah, you make informed decisions, and the same is happening in aesthetics. Sometimes it's not about, it's how they want to feel about it. That's more important. It's the confidence they gain. It's not only to show other people, it's how the women want to feel about themselves. And it's men as well. A lot of men have aesthetic treatments, and they're saying it's when the person starts to lose the confidence, they want to do something about themselves. And they try to obviously go for the shortcut. And even when in aesthetic, my clinic, they come, and women will not put sunscreen, will not have skincare routine, and want to have injections. I refuse. I first teach them to have their skincare routine, put their SPF. If they have survived for 2 months with their routine, then I say, okay, let's go for anti-wrinkle injections or something else, because it's no point for me to inject you today and then you're going to sit in the sun or not even applying good moisturizer, because then it's not going to work. It's not a long-term approach. And the same it goes to
like everything. It's everything with weight loss, with buying a clothes, buying a new car, buying something, keeping something. If you're not going to learn the underlying habits and skills required to sustain, maintain, it's a fleeting thing. And quickly, how long is somebody able to deal with these injections? So like if they're prescribed and they're monitored, what is the maximum? Is there a maximum duration?
The very first program which we have, the NHS and NICE, its maximum is 2 years they can have. They can have repeatedly. So if sometimes the patient be maybe on a 6 months and it makes a big difference, and they do come off their diabetic medication, and it depends person's attitude after that. If the person really make it life-changing decision and work on their diet and lifestyle, and it's fine. But then, the maximum on a long term, it can be for 2 years. I'm pretty sure that's the guidelines. It can be repeated as well. And it all depends on the results. If it's not giving the result to the patient, we have to stop it. And obviously, unless there is something going wrong in the monitoring as well, we think patient is going downhill.
Some people with like binge eating disorder that despite the body signals and the injection, they may just not respond. There's so many reasons. And what I would say, so like we're not saying we're against it, but I think there's 2 key things that really coming up from me and the kind of people that will be asking me, particularly in the GP practice or my health and wellbeing coaching days. that when they are like 36-year-old young woman, she's like, I've heard this weight loss injection, I'm really struggling, my mental health is affected by my body weight, can you get it for me? I think I'll be more inclined to share the information that about hypos, so you can end up dropping your blood sugar unnecessarily when you don't have an underlying medical condition, number one. Number two, if someone is eligible, and I would obviously, after it's discussed with GP or the pharmacist, then I would strongly encourage, learn the lifestyle, the other types of skills required to sustain and maintain, because then it could be a case of 1 month, 2 months, 3 months, and they will have a choice and they will feel informed. So don't use this, because a lot of the conspiracy theories were saying about dependency by using drugs rather than learning. There was also, about it's a money-making fad. It's a money-making fad. Now, media can sensationalize headlines, but you can still go on the official websites. We're not ever going to sit here and dispute a pharmaceutical product. We're just going to give you the factual information that's available to us. So we're not here to discredit anybody. We're here to inform you so you can make that choice.
Yes. And the next question would be after that, as Rav said, we said maybe the injection is not right. So how you can lose the weight? There is no magic wand. In my menopause clinic, women come for mental health, low for the symptoms. They may not be eligible for HRT or other things going on. So there is no magic wand for anything.
No.
Every human body will adapt to different way of losing weight. For example, and there is no one method would work for other. Fasting can be really good for a lot of people and it works, but for some it may not work. And there is no harm to do fasting if it works, because everyone has their own body. We call it peptide, the glucagon metabolism. That's the science behind it. And it gives signals to our brain. So we lose weight in a different way, and every human being, and we have to find our metabolites, how they break, and how the metabolite is. Your body changes. You could be the insulin, you could be the thyroid body, you could be the hormonal body, and that's why you will gain or lose weight according to that. So try to find a way how you can make those changes and see what's working for you. And no diet method or nutritional exercise method is wrong or right. It has to be right or wrong according to your own body. And find a person who can do it as well.
I harp on about this. And I say, in the bake-off, they get the bakers to make a cake without any instruction. And the best bakers are the ones who have tried and failed. And they've worked out, that's the ingredients, that's the method, that works for me. And it's the same thing with weight loss, health decisions. You listen into your body and you will figure out which food suits you, satiates you, satisfies you, excites you, disturbs you, bloats you. Like, you'll really start to understand the intimacies. If you haven't got any blockers or inhibitors, like hormonally, and there's no underlying medical condition why you can't listen to your body, like, if you do that and you're curious and compassionate and you're not in a rush, let's stop rushing weight loss. Then you will, like Dee said, you'll work it out to your unique body. And that's why watching what somebody on TikTok eats, it may not work for you at all. We have different sensory perception on our tongue. We've all got that friend that is not a foodie, doesn't care about eating, whatever, I'll have whatever. We all have that one person. I am not that person. I'm the one that's like, I want this, I want this, I want this. So we have such a unique relationship with food. And again, it's not just food. Weight loss is nuanced. It's social, it's economical, it's emotional. It's all the things that may be influencing you. And being able to be compassionate will give you the best toolkit for your weight loss.
And you don't need to be a saint to give up everything. Definitely not. But try to find. And when you go on a weight loss journey, what you have found the method in the beginning, for example, you lost 5 to 10 kg weight. you have to change in the later, the next losing the next 10 kg, 5 kg, because your fat and muscles are changing, your metabolism is changing, your gut health is changing as you're losing the weight. Then you need to do different type of method, and only you can decide for your own body. Nobody can. I love my tea. If a nutritionist asks me, tell me to stop your tea, I will not stop my tea. But I may find a way how I can adapt it to have a sustainable. So I used to have 4 or 5 cups. I reduce it to 2 cups a day now, but I'm okay with it.
And you love every sip of those 2 cups.
But I love it because I have a very emotional, psychological relationship with it. It's no addiction. It goes back to my childhood, and I would never stop that cup of tea. It goes to my mother and my sister, the bonding I had, and I will never stop it. But if that is the relationship I have.
Yeah, the moment somebody tries to make you do something that's not congruent with you, it won't work, and it will make you crave and desire things more because they don't know the attachment that you have to it. I think it's so important.
Yes.
Oh, there was something. Oh man, it's gone. There's something that I was thinking about, but yeah, it's gone. It's gone. So many things come to mind. This is why we had to do a podcast. We had to make a commitment because there's so much knowledge that we both share and experiences from speaking to and meeting real life women, and that we can't wait to keep bringing episodes each week.
We have got so many questions was asked by women, and we just made the episodes from there. It's all your questions and answers. We are a little bit struggling with the tech. You may have noticed I'm looking at that side because I still can't see Rav on my live. So this is our first start. But we survived. We did not want to cancel it, but hope so we will manage to go on our Insta Live and manage how we can do the reporting and go back on our podcast. Now, what we want from you is feedback, please. And any questions and topics, please do message us because that's we can make it more informative. It's just informal, but it's just the questions get asked and just supporting the community. And you don't have to go on Google.
We want to bring you the information nobody tells you. And I don't think many of you would have had this. So please share this because if you've got young daughters, young friends, you know, you've got people that are influenced and really struggling with their weight, like please share this with them. And I think we've kept it to around about 40 minutes. So it's watchable, it's doable.
Yeah. Okay.
Thank you. Thank you so much. Follow us on Nobody Tells You This and also Nobody _ tells you _ We'll put the links everywhere.
Thank you so much for coming and joining. Lots have joined, so thank you so much. And give us feedback and drop your questions as well, please. Thank you. Bye-bye. Don't forget to share. What did you think of this episode? And click subscribe, like, comment, and share for updates on future new episodes.